Hello and welcome to a brand new episode of Cancer Now, the only cancer-based podcast on YouTube with your freelance journalist Benedict Steininger. Last week we spoke specifically about how your knowledge can be a vital weapon against cancer. This week, however, we will take this another step forward by discussing how to differentiate between reliable and unreliable treatment. With me is our cancer expert, Professor Dr. Alexander Herzog. Hello.
Yes, hello, Mr. Steininger.
And today is the 5th of June 2020, and this is Cancer Now. Professor Herzog, why is it so important to differentiate between unreliable and reliable therapies?
Because in this decision you set up the course for the future. A wrong decision at the beginning of the disease may decide whether you run into catastrophe or whether you can cure the disease and remain healthy the rest of your life. For example, a lady 55 years old suddenly feels a lump in her breast, and so she goes to her doctor, and it could be cancer, and they make a biopsy, and yes, it's breast cancer, and the doctor recommends treatment with surgery and possibly followed by chemotherapy and radiation breast-saving therapy. So the patient says, okay, but I would like to get more information about this situation, and she looks in the internet, and there she finds rumors like if you do surgery, then you have a risk that if air gets to the tumor, then the tumor may spread, or that the surgery itself may spread the disease. You find information that there are many other ways to treat and to cure cancer without surgery. So the patient may run into a kind of uncertainty, so that she doesn't know exactly what to do or how to proceed, because on one side she gets the treatment offered by her surgeon that surgery is now necessary and maybe even the tumor should be reduced in size before surgery, and on the other side she finds suggestions of treatment without any surgery curing the disease by soft means. I have, for example, a patient just treated. She had breast cancer several years ago, 3 years ago, a small lump in the breast. She went to her doctor, got a biopsy, confirmed the diagnosis, and she decided not to have the treatment, the recommended treatment, because she said she looked in the internet and she found the new German medicine following a Dr. Hamer, where she learned that cancer is not a disease. Cancer is just a symptom of a psychological conflict. And so she looked in her daily life and social life and said, oh yes, there are lots of areas of conflict, for example, with a partner, with a family. And so she tried to solve these problems. And 2 or 3 months later, the cancer had just doubled in size and the treatment failed. So at that point she said, okay, let's look again. And she found other data showing in the internet that cancer uses sugar, and if you don't eat sugar, then the cancer will die and you can cure the disease. So she decided to change her diet in a very significant way. She never took any sweets anymore. She avoided carbohydrates. She did even use alkaline products to change the pH status of the food, and she expected again a cure of the disease so that the lump should disappear. But again, 2 months later, lump had increased in size, and the treatment obviously didn't work.
So shouldn't it work as an alarm signal that the treatment seems just too good to be true in the end?
I mean, whatever treatment you decide to do, you always have to make a follow-up to check if the treatment works or not. A big problem which I see in physicians or other therapists not doing serious treatments, that they don't make follow-up investigations. So you never really know where you are and you cannot confirm whether the treatment works or not. So a follow-up, I think, is very important. And if a follow-up after 2 months shows growth of the disease, in general this means the treatment is not working. But I have to say, you also find therapists and they claim that a growth of the tumor is a positive signal. They say, okay, in the beginning the tumor will grow for 90 days more because this shows that there is some inflammation in the tumor tissue, and then the tumor will die. And so if the tumor grows after starting the treatment, they are all quite happy. They say, oh wow, treatment works very well because the tumor grows and it's now inflamed and soon it will come off. And also this lady, she did a treatment like that I'm just talking about. This lady did a so-called study in photoimmunotherapy, which was a treatment with basically soft laser on the lump in the breast. And the therapist had told her 90 days growth of the tumor, and then she will be cured. And after 90 days, the tumor had exulcerated, which means there was now an open wound in the breast. And the therapist was excited and told her, wow, that's good, because now the tumor is coming out. That's a very positive signal. Now we have to continue this treatment, and we do it for another 2 months. So another 2 months of soft laser treatment, and the tumor had doubled in size, was smelling, was infected, was bleeding. So a very serious condition now. That was the situation when she came to me. But she was not really unhappy. She said, something is maybe not going right, and also have some lymph nodes in my armpit. But she said, I believe, and my therapist told me that what you see on the breast, which really looked terrible, this is a kind of automastectomy, which means the tumor removes itself or is removed by itself and no surgery necessary anymore. But when I saw the patient, she had not only this large tumor, she had also lymph node metastasis in the armpit, and she had developed in this time of treatments before more than a year also liver metastasis and lung metastasis. So from a situation in the beginning, a small tumor, and the chance of a cure, she's now in a metastatic situation. The chance of a cure is very limited. We are now working and fighting to prolong her life, to keep the disease under control, to reduce complications, and also to shrink the tumor, of course. But the excellent chances the patient had in the beginning, they are now gone.
So what would be the next step in that case?
For this lady, let's just stay at this example. This lady got then a program consisting of chemotherapy. She also got complementary treatments to help the body to recover after the chemotherapy. She also got hyperthermia to increase the efficacy of the chemotherapy so that we could use lower doses, and we could really watch within a few weeks the breast tumor got much smaller. Another few weeks later it had gone and was a scar healing like after surgery. Also the lung and liver metastasis almost had gone. So a very good result. But, and that's a problem if you have a metastatic disease, even with a very good response, there's a high risk that the disease will come back after a while again and then cause later on problems again. Then you need maybe other treatments. So a continuous treatment is necessary now, more or less.
So how can you learn to differ between these two therapies, and are there any helpful tips?
If you look in the internet as a source of information, which for many patients nowadays, as with active social media, is a must, you have to look first who claims the treatment. Is it a recommended institute, for example, a university hospital, an accepted, acknowledged society of cancer, where international experts discuss different treatments? These treatment suggestions in general are very reliable, and they are based on studies which show that the treatment works or does not work. If you find treatments, very simple treatments, let's say for example just leaving the sugar away and the cancer is cured, then you should be careful, because cancer is a very complex disease, and just changing something very simple, for example the uptake of glucose, is not likely to work. Also you have to see that if you have very simple treatment curing cancer, why is not everybody doing it? Because much cheaper than doing any kind of surgery, chemotherapy, radiation, if you just don't eat carbohydrates or sugar. If this treatment really existed, it would be spread much more, and all specialists would recommend this treatment as first-line treatment. So if you see a treatment recommended as a cure of cancer, as a miracle cure, and it's not accepted in the world somehow, then you have to be careful. Then something is wrong, because it's not that simple. Just take back to the thesis, glucose and cancer. Of course, cancer cells take up glucose like all our body cells. And also they serve themselves first. We know that when we make a so-called PET scan, when we inject radioactive labeled glucose, we can see that the brain takes up the glucose, the heart muscle, but also the cancer cells in the first row. So it means that even the fasting condition, when you make the PET scan, the cancer cells are still able to take up glucose out of the normal blood sugar level. And you need a certain normal blood sugar level, because if not, then, and if your blood sugar drops too deep, then you are in coma. You cannot live, although the cancer cells are in coma, but this is not a possible treatment. So it's just not working. So these simple treatments just are not enough to treat cancer. So if you find such an idea that with a simple treatment like not eating sugar, cancer can be cured, you can, in general, can say, okay, forget it, it cannot work. There can be maybe some background, but in general this cannot be enough, otherwise everybody would do it. There are other treatments which are also recommended. For example, let's take the so-called vitamin B17, or latril, the older name. It's a substance more than 60 years old. It's not a vitamin, It's just claimed vitamin, but it's not a vitamin because vitamins are necessary for the body to work. Vitamin B17 is an extract of apricot kernels, and it has been claimed long time already that this may cure cancer. But up to now, there's not one single study showing that it has an effect on cancer. There are only a few studies published on mice that it has maybe some effect on the immune system, but any research was abandoned many years ago because first this substance was banned in the USA because of false promises, and second, there was obviously not enough interest internationally to do more research on this substance, as many other treatments came up with much better outcomes and much better possible success rates. And then you find, for example, when you look into sources claiming that substances like laetrile are very effective, they very often combine this with a so-called conspiracy theory. So they tell, okay, there's a cheap, simple medication which may cure cancer, but this medication is banned for that because Big Pharma wants to sell also continuously expensive chemotherapy drugs. And that's why simple medicines and cheap medicines have no chance to really come out and to be used. That sounds plausible for the moment, but if you really use common sense, you may think, okay, if there's really a cheap medication, why should any health insurance pay more expensive medications? If there's a cheap and simple medication, why should doctors who try to help their patients use not simple and cheap medications and instead toxic and very expensive chemotherapies? So that's not logical. So these conspiratory theories, if you find that together with any substance, there's always something wrong with the substance. So this is also another alarm sign.
So if you yet still consider one of these treatments as a patient, what should you do to make sure that this treatment is or is not effective?
I would look first for the sources, of course. Then you have to look, is there any study published about the efficacy of this treatment? And study means not studies just on experimental dishes, because that's not enough. This doesn't reflect real life. For example, if you have cancer cells on experimental dishes, you can pour salt water over the cells and they all will die. But nobody would now expect that salt water kills cancer. So you have to look for studies in real life, which means studies with patients. So if you have studies with two groups of patients, one getting the treatment, the other one a placebo or another treatment, and then you can compare the results, this in general is a reliable study. These are often also so-called randomized studies, so that you don't choose the patients are chosen for you by coincidence. So if you have such studies, you can always trust the results much more than just somebody claiming an effect without showing any study. So let's look, for example, for vitamin B17. There's not one single study published. Let's look for treatments like insulin-potentiated chemotherapy. There's also not one single study published in a way to convince oncologists to use that. So besides researching on your own, it's also very important to speak with the doctor treating you, to show him what you found in the internet, write down your questions, and then really take the time to go through every single question to get a sufficient answer. That can be very helpful, and the doctor treating you will try to give you the best possible answer. Will try means that also some physicians just have not much knowledge about alternative treatments offered in the social media. So it's very difficult sometimes for patients to find a specialist oncologist being able to explain you also the pros and cons for certain alternative treatments. There are some alternative treatments which may be beneficial, and others are just rubbish. But a doctor should have knowledge about these treatments. Otherwise, he or she cannot explain you if this treatment may work or not work, and he or she may not be able to explain you why a certain treatment doesn't work. For example, avoiding sugar, why doesn't it work? So here, it's very important that you find an oncologist who has knowledge and experience not only in the classical traditional medicine, also he should have competence and information about other treatments, complementary treatments, but also alternative treatments or not serious treatments.
In the world of medicine, doctors are often referred to malpractice. How does that work within cancer? How do you know how reliable even doctors or hospitals can be in regards to malpractice?
Here we have to distinguish. Malpractice means a doctor should follow the normal rules in medicine and makes a mistake. That's malpractice. The other topics we had before was offering not serious methods without evidence of efficacy or benefit. Malpractice is something different. It means more or less a mistake, and mistakes unfortunately happen in every profession. Doctors, pilots, everybody can make a mistake, and it's very important to learn from mistakes and to improve in this way the daily treatment. Malpractice happens, of course, more if doctors are overloaded by work or if they have other problems. Then also if the doctor is not very experienced in a certain treatment. Let's say if you have a complicated bowel problem and you need a difficult bowel surgery and you go to a hospital where only 1 or 2 of these surgeries are done per year, then you can expect a worse outcome. Whereas in a big hospital, big city hospital or university hospital, where these surgeries are done every day, then you have an excellent, or much more likely an excellent outcome. And here, this is a good way to find out. So if you have difficult disease and you need a difficult and maybe dangerous treatment, then you should go into a very experienced center. This improves the prognosis. And there are many studies showing, for example, in colon cancer, that patients going to a more experienced center have the better prognosis than patients going into a not as experienced center. This improvement of prognosis is much better than any improvement of prognosis by additional chemotherapy, by the way.
So what is left to do when you lose valuable time through the wrong therapy?
I mean, it's your right to choose the treatment you want as patient. So I don't think that a patient can be forced to do any treatment against his or her will. But first thing, if you decide for a treatment which is maybe outside of the mainstream medicine, the most important advice is to make a good follow-up. To say, okay, maybe I try something different, but I want, of course, to check, does it work? And if a check is not offered by the treating therapist, then you should make sure that you do the follow-up yourself. For example, check by scans if the tumors get bigger or smaller, blood checks of tumor markers. This always is helpful. And if you see that this treatment is not working and it looks as if things are getting worse, then you should rather sooner than later try to get a second opinion and also try to find your way back to the mainstream medicine, to ask an expert there to what to do in this situation if it has. Now it's more difficult than before, but there's still a chance and you still can keep your best possible chances. So that I think it makes sense to decide early enough, okay, this was maybe a mistake what I did. I have to go back to mainstream medicine, get some more information there, get advice there, and then decide in time for a treatment with better efficacy and benefit. This is, I think, the most important step, not to be ashamed to do that. Many patients are ashamed to admit now that they have done something wrong and now are in a much worse situation than before. But I also see on the other side, the physicians sometimes are not happy with the patient when the patient comes back in the situation, and they show that to the patient by making the patient even feel more ashamed, telling, how can you be that stupid doing these treatments, and why did you follow these charlatans? And this is also not helpful for the patient. The patient is under pressure enough now in this situation, seeing the disease progressing, and so it doesn't really make sense if a physician even increases this pressure. So it's better to say, okay, there was maybe something wrong in the past, but let's forget that now. Let's now look forward. Let's see what we can do in the future. Let's see how we do the treatment in the future in the best possible way.
So it's always important and necessary to show some compassion to your patients.
I think that's very important. The most important is to have empathy, to show compassion, to try to help the patient to find the best possible way. And this also means, of course, to discuss with the patient. So you need time for that. You have to discuss pros and cons, especially if you have a patient who tried in the past to avoid any kind of chemotherapy. And now you have to convince him or her that we maybe should go back to this medicine, we should maybe use this weapon. But you can also tell the patient there are measures to help to reduce the side effects or to detoxify the body after the treatment. Though such a treatment, which normally is seen as very dangerous, in the right setting can be much less dangerous and is tolerated much better. And suddenly somebody who didn't allow any kind of chemical treatment before now suddenly allows this treatment because it's maybe the only chance, and now in this special setting he or she believes it's now easier to go this way, and then the results often are very good, still very good, even in a very advanced situation.
So last week we spoke about how important it is to consult your doctors when you get your biopsy. At this stage of the therapy, if you have lost too much time, is there any possibility that you can still consult different doctors if it's necessary?
You always should take the time to consult as many doctors as you think are necessary. You should have as a patient a good gut feeling if you go to a certain center or doctor where you are treated, because that's very important in the long run. And even if you have a cancer which has maybe 1 or 2 centimeters, a treatment decision does not have to be done in 1 or 2 days, because a tumor of 1 or 2 centimeters may have existed now for more than a year, just from the first cell until the size now, maybe even much longer. So a treatment delay and time of decision of 3 or 4 weeks doesn't matter at all in this situation. So you really have enough time to decide, get a second opinion and even maybe a third opinion, especially in a situation which is not very clear. Sometimes you have pancreatic cancer of a certain size and the question is surgery yes or no, benefit yes or no, to make here the right decision, because much often easier to do a treatment and just to do something, not admitting that this treatment is maybe more dangerous than not doing this treatment. There are sometimes really difficult situations and conditions, and in particular in this situation you need a second or third opinion of an expert.
To have our last question of today, to come back to your patient that you were talking about in the beginning, how did the situation clear out in the end?
The patient had a very good response after the chemotherapy, so the metastasis got much smaller, the breast tumor, the ulceration completely healed. But in the long run, unfortunately, the disease will come back and at some point the lady will die. This outcome fits very well to a doctorate thesis we had performed at our hospital, checking in the last 20 years all patients with breast cancer and focusing on the group of patients who in the beginning decided not to follow the mainstream medicine, not to have surgery, not to do chemotherapy, no radiation. And we just wanted to see in this retrospective study the outcomes. And the outcome was very negative. So it means compared to other patients getting the correct treatment from the beginning on, these patients had a significantly shortened survival time.
Unfortunately, this is all we have time for today. But don't worry, next week we will continue to talk about this very important topic and we will answer as many questions as you will send us. Professor Herzog, unfortunately we are at the end, so thank you so much for your time.
You're welcome, Mr. Steininger.
It becomes evidential that reliable treatments can be identified through simple research and common sense. Furthermore, it is certain that through unreliable treatment, the health of a cancer patient becomes worse, as often patients lose too much time to maintain a good future outcome for truly efficient treatment. In our next episode, we will discuss using examples how doctors view the knowledge of patients. We hope to receive more questions in the upcoming days so we are able to help you further. As a competent patient is a healthy patient. If you enjoyed this episode, then leave a like below, subscribe to our channel or on our social media accounts to never miss an episode. This was Cancer Now with your freelance journalist, Benedict Steininger.